Is it the cold, the flu, or maybe even an ear infection? It's that time of year when a lot of kiddos are starting to feel sick, and it can be pretty hard for parents to figure out what the real problem is. Tonight, Channel 2's Lauren Freeman explains how to spot the symptoms of an ear infection, also what doctors recommend as the best treatment.
This time of year, viral infections are as common as the changing weather. Pediatrician Dr. Albert Reichert Jr. says he's treated lots of young patients with runny noses, congestion, and cough, and says most colds resolve on their own. But sometimes an ear infection will develop as a complication.
When you have a cold, you get some swelling of the tissues of your sinuses, and that swelling can basically block up the drain, block up the middle ear space, and fluid can accumulate in the middle ear space.
When that fluid sits, it can become infected.
And that infection causes some pressure and some bulging of the eardrum, which can lead to pain.
It can be hard for a parent to know whether or not a child has an ear infection. Dr. Reichert says if the symptoms develop right after a cold, it likely is.
The main thing is understanding what a cold is maybe a little low-grade fever just in the first day or so, and then after that some runny nose and congestion for about a week. So when it doesn't follow that progression, when they've been sick for 2 or 3 days and all of a sudden they're running fever or suddenly a lot more fussy, that can be a sign that something's changed, and often that can be an ear infection.
Tylenol and Motrin can help ease the discomfort. Antibiotics are given after a diagnosis. If the ear infection becomes worse, that's when Dr. Reichert says tubes are considered as a long-term solution.
The number of ear infections really isn't as important as the duration of the fluid behind the eardrum. When your middle ear space fills up with fluid, your eardrum can't move properly and it muffles the sounds. And so kids who have fluid in their middle ear space don't hear clearly, and so they don't learn to speak clearly.
Some signs to look for in your child: a fever above 102 degrees, tugging at the ear, increased irritability, and crying when lying down. Lauren Freeman, KPRC, Channel 2 News.